There are lots of different ways of approaching a walking problem. An important part of the evaluation I do in people is assessing whether the nerves and muscles are working properly. For that, one of the tools that I employ is a technique known as electromyography. We actually study the electrical signals that nerves and muscles make in the same way that an electrocardiogram tells a cardiologist about the heart's health. We can tell about the health of the nerves and muscles in the arms and legs. So that's an important tool that I use as part of my assessment. Based on that analysis of x-rays, images like MRI, and other testing we might do, would roll into applying appropriate treatments, many of which revolve around the area of physical therapy. As a physical medicine and rehabilitation doctor, I work very closely with the physical therapy team, occupational therapy and speech therapy team that we have at Ohio State, coordinating things with them so that they can focus on aspects of recovery of function, strengthening, recovery of balance, and things like that. And also looking at whether we might use a brace on one ankle or the whole leg in a particular individual. We might use a cane or a walking stick. Some people with more impaired balance might use a walker. In a complicated case where balance is severely disrupted, we might find that using a wheelchair is the most efficient and effective way for people to safely move around, or at least move around longer distances if their walking is limited to a short distance. And we think of all of these devices, canes to wheelchairs, as tools that individuals might use in a specific situation when they might walk around their kitchen or their bathroom at home, but their workplace might require traveling longer distances than that. So they might use a wheelchair or they might use a walker in another situation when they don't have as many things to grab onto, to hold onto, or places where they can sit down easily.